Good afternoon, everyone. So today clinical discussion is on SGA, that is systemic juvenile idiopathic arthritis. So SGA, more than SGA, we'll talk what is GIA, that is juvenile idiopathic arthritis. So it's a chronic immune mediated arthritis which is previously called as juvenile chronic arthritis or juvenile rheumatoid arthritis. So why it is called as juvenile idiopathic arthritis is the cause is not known, how it happens and for what it happens, and juvenile is it usually happens under the age of 16 years. So according to the International League of Associations for Rheumatology, they have defined a criteria how to define GIA. As a chronic arthritis, they consider it as if it is 6 to plus or minus 6 week duration with no known cause occurring in children before the 16th birthday or below 16 years. So the ILAR classification categorizes GIA alone as 7 different categories based on the number of joints that are involved and extra-articular features that are present, serology that is identified. So among these GIA, the one specific topic what we have taken is SGIA, so we'll get to know what it is. So this is the classification given. So first type of GIA is oligoarthritis. So in this oligoarthritis, the 1 or 4 joints are being affected in the first 6 months of the disease. So two types are there, one is persistent and the one is the extended one. So persistent is it affects more than 1 or more than 4 joints throughout the disease course, that is for the 6 months what they have taken. But if it is an extended oligoarthritis, it involves more than 4 joints and also it extends, the disease extends more than 6 months of its normal duration period. So this exclusion criteria later we'll see what it is. So the second type of GIA is polyarthritis rheumatic factor negative. So in this, the arthritis affects 5 or more joints during the first 6 months of the test, but when the blood test is done, the RF factor will be negative. And another one is RF factor is positive, same to the negative one only. It involves 5 or more joints through the 6 months of duration of the disease, but when the tests are performed within the 6 months period consisting of 3 months apart, like 2-3 tests are done, so both the test or all the 3 tests should come positive. The next one is the systemic arthritis. So arthritis consisting of involving 1 or more joints which consists of fever, that is for duration of 2 weeks, and in these 2 weeks daily, the period of 3 days continuously the fever should occur. So with the fever and with the involvement of 1 or more joints, they should either be presenting with 1 or more of these following, like the evanescent erythematous rashes. They are like these wheals lesions that occur, like they are patches, black discolored patches that become raised on the skin. And the next is generalized lymph node enlargement, hepatomegaly and splenomegaly, and serositis. So serositis is inflammation of the serous glands like this pleura and pericardium, like that. So next is enthesitis related arthritis. So enthesitis is inflammation in the regions of tendons and ligaments where they are connected to the bones. When the tendons and ligaments are like inverted into the bones, so those areas will become inflamed. So in this, what are the criteria? The presence of a history of sacroiliac joint tenderness or inflammatory limbosacral pain, and also present of HLA-B27 antigen. So this HLA-B27 antigen is present in the body that helps to differentiate the body's own cells and also the foreign bodies that are entering into the body. So that differentiation this antigen will help to make inside the body. So onset of arthritis in male over 6 years of age, acute anterior uveitis, history of ankylosing spondylitis, enthesitis induced related to arthritis, then sacroiliitis with inflammation bowel disease, then Reiter's syndrome or acute anterior uveitis in a first degree relative. Psoriatic arthritis. Psoriatic arthritis, we know psoriasis, it's a skin disorder. So this arthritis occurs specifically in people who are having psoriasis. So this is the psoriatic arthritis. So in this, it consists of like different dactylitis, that is inflammation of the fingers and toe joints. then nail pitting and oncholysis, then psoriasis in the first degree relatives. Undifferentiated arthritis is, if any of these arthritis they are not able to classify among the above, so that will come under the category of undifferentiated arthritis. So that exclusion criteria 1, 2, 3, 4 was there, no? So these are the 5 different points where they are excluding in some particular different cases. So among the 7 classification what we saw, we are concentrating mostly on SOJIA, that is systemic concept of juvenile idiopathic arthritis, because that is one of the rarest form that is seen. About 10 to 20% of the children who are having GIA have the rarest as well as the serious form, that is the systemic juvenile idiopathic arthritis. So systemic means it not only involves the joint but also different body parts, majorly lungs, heart and liver. So the person, if it is not treated, it might lead to multiple organ failure and they may lose their life also. So SOJIA, sometimes referred to as Still's disease, can occur in childhood and it can be very early diagnosed at the age of 2, and the prevalence rate in both in girls as well as boys are equally affected. There is no like differentiation. So SOJIA also differs from different other subtypes, that is only considered as auto-inflammatory rather than autoimmune disease. So I'll explain why it is auto-inflammatory and not autoimmune. So SOJIA is more severe and can be more challenging to diagnose and treat the other type of juvenile idiopathic arthritis. So causes, SOJIA causes are specifically not known. What they feel is either they are having some genetic predisposition or it is an environmental factor that is causing them. So the body consists of like 2 different immunities. One is the innate immunity and one is the adaptive immunity. So when innate immunity is taken, it is taken from the birth. So that is how it acts as defense mechanism to any foreign body that is entering your body, inside the body. But adaptive immunity is acquired during the course of your life, and it usually serves when the bacteria or any foreign bodies are passing or slipping through the innate immunity and then harming the body. So most form of GIAs that have developed are adaptive immune system, because they are overactive and attacks the healthy cells as well as the tissue. So this disorder is called as autoimmune disease. But SOJIA is comparatively different. It is called as auto-inflammatory disease condition because the innate immunity here becomes overactivated, and that's the reason overactivated even in the cases when the body is not under the stress or there is no infection or there is no any condition where the immunity have to be activated. So and that too, it is the immunity that is acquired at the birth. So that's why it's called as auto-inflammatory disease. So children with SOJIA usually don't have auto antibodies in their blood, but many kids with the other different forms of GIAs they have. So auto antibodies are usually formed when the adaptive immune system is overactive. So in SOJIA case, what happens is there is increase in levels of inflammatory proteins such as cytokines, interleukin 1 and interleukin 6. So as a result of which there is increased of these inflammatory proteins, that's why it is called as auto-inflammatory disease. So what are the different health effects that an SOJIA can do? So macrophage activation syndrome. So due to the increase of the massive inflammatory responses that causes overwhelming of the body, and some of the trigger factors are like the viral infection, medicational changes or flare or spike in a disease activity. So 80% of the cases what they have seen are due to this macrophage activation syndrome. The next is the lung and the heart problems. Basically two major type what we see in SOJIA are pulmonary artery hypertension and the interstitial lung disease. So in pulmonary artery hypertension, what happens is it affects the arteries of the lungs, and as well as it decreases the pumping of the it decreases the blood pressure that affects the arteries in the lungs and the right side of the heart. The interstitial lung disease, so in this the lung tissue becomes scarred and makes it harder to get the oxygen into the bloodstream. So parents also should look for the signs of breathing problems, shortness of breath, and notify their pediatric rheumatologist as soon as possible. So coming to bones and joints, persistent inflammation can slowly damage the joints, leading to reduced range of motion, loss of function, and sometimes you require the joint replacement in early life. So if it is not well controlled, it may lead The other type of juvenile arthritis may affect the jaw joints, sometimes even the spines are affected, hip joints are affected, so it might become quite severe, and the patient might also be immobile at a very young age. High blood pressure such as hypertension. Hypertension can occur for at least two reasons. So one is the atherosclerosis. So even though we know that the child is at the younger age, but because of the disease there might be atherosclerosis that occurs, and this causes a narrowing of arteries and decreases the pumping of the heart. So although atherosclerosis develop in healthy children, it is seen more often in SGA due to ongoing inflammation. So more frequent cause of blood pressure in treatments are corticosteroids, which causes fluid retention and weight gain. So some of the symptoms that occur, first is fever, like I told. So the criteria for taking SGA is the patient should have fever for a duration of 2 weeks, and for continuously 3 days he should have the fever. And and the degree of temperature should be 103 degree, and mostly in SGA one of the classic signs is, how you know that it is SGA, classical signs are 103 degree temperature, and in the evening times the temperature comes and it drops at the night. So this is one of the classical sign how to go for the diagnosis of the SGA. Then sometimes it might be associated with rash, like a flat pink or pale rash depending on the child's skin color. Often occurs on the child's trunks, arms or legs, although it can move from one part of the body to other. So the rash may be itchy, but usually it is not. So it tends to last for few minutes or few hours and associated with fever spikes. So joint pains, like we told, the proper treatment is not given. There will be swelling, pain, stiffness, warmth also. So usually we tell when children are growing, we tell it's growing pains. So most of the times we neglect it. So parents also should be aware, if anything such signs are being seen, immediately they have to take up to the pediatrics and get them checked. So SGA symptoms may also come and go, but periods of lot of inflammation and worsening symptoms are called as flare. Sometimes the flare can last for days or months. So diagnosis. So diagnosing of SGA usually requires like high fever of 103 degrees Celsius for a duration of 2 days, and also occurring at the evening times. And arthritis is also involving of joints, pain as well as inflammation for one or more joints for at least of 6 weeks. So this is the